Okay, in this video, we're going to continue to talk about infant assessment and care. So we're going to start off by talking about gross motor skills and fine motor skills. There's a lot of growth and development in those areas during the first year. So you do need to know that at each month, what new skill or what milestone the infant achieves. So let's first talk about gross motor skills. At 1 month of age, the infant will still be demonstrating head lag. So head lag is basically like poor head neck control. So they're just not able to kind of keep their head like upright and in line with their shoulders. At 2 months of age, they will raise their head when they're prone. So if you place your baby on their tummy, they will raise their head up. And then around 3 months of age, only slight head lag will remain. They should not really have any head lag present around 4 months of age. So they shouldn't have that like bobbly head where they can't hold it up. At 4 months of age as well, they should be able to roll from their back to their side. At 5 months, they should be able to roll from their front to their back. And then at 6 months, they should be able to roll from their back to their front. So that's the hardest one for them to do. At 7 months, they should be able to sit up by leaning forward and kind of supporting themselves with both of their hands. And then at 8 months, they can sit up unsupported. So they don't have to lean forward on the hands. They can actually just sit up normally. That's an important milestone to know. And then at 9 months, they should be able to pull up to a standing position and also creep on their hands and knees. 10 months, they should be able to go from a prone position to sitting. And then at 11 months, they should be able to walk along while holding on to something. And then at 12 months, they should be able to sit down from a standing position. So those are some important gross motor skill milestones that I'd be familiar with. If you have the cards, they're on card 9. So it's good for memorization that way. Okay, let's talk about fine motor skills. So at 1 month, the infant will have their grasp reflex present. So we talked about the reflexes in my previous video. So they'll have that reflex still present. At 3 months, they should no longer have that grasp reflex present. At 6 months, they should be able to hold a bottle themselves. At 7 months, they should be able to move objects from hand to hand. At 9 months, they will have a crude pincer grasp. So a pincer grasp is where you use kind of like the forefinger and thumb to hold something. So it'll be kind of a crude pincer grasp. And then at 10 months, they should be able to grab a rattle by the handle and kind of shake that around. And then at 11 months, they should develop a neater pincer grasp and be able to put objects in a container using that neater pincer grasp. And then at 12 months, this is an important one to know. If you're in nursing school, they should be able to try and build a 2-block tower unsuccessfully. So they will not be able to do it successfully. It will be an unsuccessful attempt at a 2-block tower. So I definitely know that. Okay. Let's talk a little bit about some language milestones that you can expect with infants. So we would expect an infant to have like at least 1 word by about 10 months of age, and then approximately 3 to 5 words by 1 year of age. In terms of separation anxiety, this is definitely expected and normal that a baby would exhibit separation anxiety. So this is where a baby would protest when separated from their parent. You would see this begin around 4 to 8 months of age. And then stranger fear is another thing that is common and expected. So this is where a baby is less likely to accept a stranger, someone they don't know. This is evident between 6 and 8 months of age. So in terms of age-appropriate activities, the infant will be engaging in solitary play. So they're not interacting with other children. At this phase, you don't expect them to like have this collaborative type play with other children. They'll be playing by themselves. Solitary play is expected at this age. So appropriate toys can include rattles, blocks, balls, teething toys, nesting toys, and like playing patty cake. Okay? So So those are expected kind of activities and toys that you would expect an infant to play with. And I am going to stop here. When we pick it up in my next video, we will talk about immunizations, which is a big topic, and I've got some tricks to help you learn that. So stay tuned.